This image is showing Barrett esophagitis, also known as reflux esophagitis. In the distal esophagus, there is nodularity and granularity. Due to mucosal inflammation and edema, it's almost always in the distal esophagus, sparing of which should prompt another diagnosis. The barium study is showing concentric ring less than 2 mm in thickness, characteristic ringed esophagus of eosinophilic esophagitis, which is diagnosed by intraepithelial eosinophils. Fungal infection like Candida occurs in immunosuppressed patients like AIDS. On barium study, there is plaque-like defect with intervening normal mucosa. In AIDS patient, confluent plaque and pseudomembranes causes shaggy esophagus. In herpes esophagitis, first there is blisters and vesicle which ruptures to form punch-out ulcers, arranged in linear clusters and punctate configuration. Imaging-wise, HSV and CMV esophagitis are indistinguishable. Eclasia cardia occurs due to damage of the meandric plexus of esophagus. It's of two types, primary and secondary. In the primary eclasia, impaired opening of the lower esophageal sphincter causes distal narrowing and tapering, resulting in a bird beak appearance. Secondary is due to mass lesion causing shouldering and nodularity of the distal esophagus. The length of narrowed distal esophagus helps in differentiating primary versus secondary. In secondary, the length is more than 3.5 centimeters, but in primary, it's less than 3.5 centimeters. The barium study is showing two rings A and B. The A ring is a muscular ring covered by squamous epithelium in the distal esophagus. B rings are mucosal rings at the squamo-columnar junction. If symptomatic, they are also known as Schatzki's ring. Along the anterior wall of cervical esophagus, there are thin fixed filling defect known as esophageal web, which is associated with Plummer-Vinson syndrome, which is a triad of iron deficiency anemia, dysphagia, and esophageal web.